So BBL, frequently asked questions. So probably one of the most commonly asked questions I get is, when can I sit down? Now, always this advice is at the discretion of your surgeon, and they will give you the most relevant advice to you. As a general rule of thumb, it tends to be about 3 weeks. Now, there are things that you can purchase, such as BBL cushions. I personally think the M-shaped ones are much better, depending on where you have the fat transferred to. For example, if you have fat transferred to your hips, sitting in a donut cushion is not necessarily the best thing, because you're going to put pressure on the fat there. Now, the main reason we don't want you to sit down, it's not because we're trying to torture you. It's just because if you sit down, you can cause fat necrosis, and that causes, essentially that's the death of fat tissue. So that can cause irregularities in your results, misshapen results. Basically, it doesn't cause you the best results, and we want you to have the best results. So 3 weeks for sitting. That goes for lying on your back as well. So unfortunately, it doesn't mean you have to sleep on your front. So it's front sleeping for 3 weeks, but I like to think of it as 3 weeks for the best result for the rest of your life. So in the grand scheme of things, it's a dot in the sea. So it's nothing to worry about overly. And obviously we'll be here to support you should you have any worries or concerns about that. One of the things you can do, if you're someone that sleeps often on the side and you're worried about turning over, I always recommend just padding yourself up, essentially making yourself a little pillow fort, so you're stuck on your front essentially for those first 3 weeks. Now, the biggest thing with BBL as well is absolutely no exercise for 6 weeks post-operatively. Now, this doesn't include walking. You're fine to walk as much as you like. If you have a dog, walk your dog, that's fine, it's no concerns. But no running, no HIIT, nothing that's going to increase blood pressure or heart rate. Anything that increases heart rate and blood pressure increases blood flow to an area of trauma, and what that's going to do is going to cause significant swelling, increase your risk of bleeding, and increase your risk of a complication. So I'd say it's just best to avoid it. Now, a big popular topic at the moment is having a BBL done in Turkey. Now, I'm not here to tell you what you should or shouldn't do with your life. That's completely up to you. All I can do is tell you the medical risks and the clinical risks of getting a BBL done in Turkey versus getting a BBL done in the UK with a registered surgeon. Now, all surgeons in the UK are members of the GMC, which is the General Medical Council, which makes them accountable towards a clinical governance, essentially. So what that means is that they are assessed and managed for their safety, so you know that you've got someone who is top tier, essentially. One of the problems with BBL abroad is a very simple problem, is that they'll often say you're free to travel home afterwards. Now, travelling home after a BBL has its risks. One of them being that if you're going to apply weight to an area which has had fat transferred to it, you're going to increase your risks of something called fat necrosis. Now, what fat necrosis is when the fat cells die. Now, obviously, that is not something that you want if you paid for a BBL for it to die. It also leads to irregularities, uneven surfaces, changes in colour. It's not the appearance of the BBL that you're wanting in terms of a ideal look, essentially. Now, also one of the issues with having a BBL abroad is that you can have more risks of complication. Now, if you do have a complication abroad, this won't be managed when you come back to the UK. Essentially, a surgeon who takes on a BBL that's happened abroad is then liable for the results that happened abroad, which is a different council, different registration, and a different kind of standard of care, essentially. So it's at your own risk. You then become stuck in a situation where you would have to travel every time you required care, which can become much more expensive than just having the procedure done in the UK and in the first place. So it can be a much more serious implication to do it that way. Another problem with a BBL abroad is in terms of recovery time. Now, it might sound nice, the idea of recovering on the beach. In reality, it's not so nice. Should you need medical attention, should you require a nurse, it's much more difficult for you to get hold of someone who is going to be able to help you straight away, essentially. So with Centre for Surgery, all your follow-ups are included within the price of your procedure. So should you need any medical attention, ever require a follow-up appointment, that's with a doctor or a nurse, that's made available to you, and someone will always be there to answer any call that you need, essentially.